Today I want to talk about the best exercise to do immediately following your breast surgery, whether it's for breast cancer, whether it's an augmentation or a reduction, or any other surgery that you're having done to the chest. Now there are a lot of great videos that are out there, but I want to focus on the first 2 weeks after surgery, when you may still have drains in, when you're typically in the most pain and you're rounded and you're guarding your chest wall because it hurts, you're inflamed. There are actually a number of great things that you can do to try and relieve some of your pain, get some early motion, and there are safe ways to do it in order to avoid seromas, which may be an early indication of lymphedema. So first, let's keep in mind where you're at. You've just had surgery. Maybe your doctor has given you a few exercises to do at home, maybe not. Regardless, I want you to do what your doctor recommends. But typically, right after surgery of the breast or chest wall, we're in a lot of pain. We typically tend to be rounded forward, so you can see what that does to my shoulder and my upper back. And we really need to maintain a nice upright posture so that we don't lose range of motion and function long term. Now, the first thing I want you to remember is if you have drains in, don't go above 90 degrees. So here is 90 degrees. Anything overhead should be restricted at this time. Now, I want you to put your hands on your upper thighs and I want you to squeeze your shoulder blades back together. So when you're doing this, I want to make sure that your shoulders are staying down. That's why your hands are on your thighs. I tend to find if I don't tell patients to keep their hands on their thighs, they do something like this. We want to keep the shoulders nice and low and squeeze back like you're trying to pinch your shoulder blades together. Squeeze back. And from the side, you can see squeeze back, squeeze back. If this is too hard or painful, simply standing against the wall and trying to touch the wall right behind you with your shoulder blades is a different cue that might work for you. Now for the next exercises, I want you standing against the wall with your hands by your side and your palms facing away from the wall. So what you're going to do is you're gently going to put your hands against the wall, so your back should be flat against the wall, and you're gently going to push your hands back into the wall. Now it might be the back of your hands that touch, it might be your wrist or forearm, whatever it is, you're pushing the arm gently into the wall. So if you think about it, as hard as you can push, maybe about a quarter of that. Now you're going to feel the muscles of the arm and the back working in order to perform this exercise. So relax, then push back, hold 2 or 3 seconds and relax. Push the whole arm back and relax. As you can see, nothing else in my body is moving. You want to make sure that you're not compensating by using other muscles of your trunk or arms in order to complete these exercises. These are very basic exercises. They're designed to get your blood flowing and your lymph flowing and to incorporate movement and improve posture and get you out of that rounded, protected posture. These exercises should be done 10 at a time, twice a day, maybe 3 times if you're feeling up to it. As always, clear any exercise routine with your own medical team to make sure that it's appropriate for you. Another great exercise is just moving your arms. So touch up to the shoulders and down to your side. Up to your shoulders, down to your side. Up to your shoulders, down to your side. All we're doing is moving the muscles around the elbow in order to get them contracting and pumping fluid out of the arm. If you've been given exercises for raising and elevation, just make sure you're doing them below this 90-degree plane. And finally, the last exercise for today is a simple grasping, gripping, or squeezing exercise. So I have a little gripping ball here. I'm just going to squeeze and relax. So again, you're not squeezing as hard as you can. You're just squeezing enough to contract the muscles of the hand and wrist in order to pump fluid. Now I like to do 10 with the elbow bent, 10 with the elbow straight. If you don't have a gripping ball, take a pair of socks, roll it up into a ball, and there you have it. It's not about how strong or how hard you're squeezing. It's simply about getting the motion. My name is Lisa Berman Sylvestri. I'm a physical therapist and a certified lymphedema therapist, and my goal is to keep us all lymph smart.